Good morning, everyone. My name is Beth, and I'm with the Education Alliance. At the Education Alliance, we work to connect businesses and community partners with public schools across West Virginia. Our goal is to help students discover career possibilities and build skills and confidence that they need for life after graduation. Today, we are so excited to partner with Vandalia Health, giving you a behind the scenes look at real careers and real workspaces. This session is meant to be interactive and engaging, so as our speaker shares his knowledge, I encourage you to write down any questions or thoughts that you come to mind, and we will have time throughout the session for questions and answers and conversations. With that, I am happy to turn things over to Guy from Vandalia Health to get started.
Well, thank you so much, Beth. Hi, everyone. My name is Guy Stewart. I'm a talent acquisition specialist with Vandalia Health. I've been doing it for about 6 years. Absolutely love it. Hope I get to retire from this organization. It's a great place to work. Just to give you a little bit of background on me, I've born and raised here in Morgantown, West Virginia. I've left a couple times, but I always find my way back. I attribute that to the community and the people that live here. It's just such a great place. I always find myself back. I started with my bachelor's degree at WVU in business administration with an emphasis on marketing. And I've had a wide variety of different roles throughout my career. I started out as a real estate agent, and then I went on to become a landman and title abstractor in the oil and gas field. Boy, that money's great when it's there, but it's a roller coaster of an economy. So I wanted something more secure as I moved my way up through my career. So I decided to go back to school, get my master's in industrial relations and human resources at WVU. From there, I became an executive at Target, and I worked there for about 4 years, and then found my home here at Mon Health and Vandalia Health. And I've never looked back. Healthcare is an incredible career path. It's something that's very fulfilling. You get to give back to your community. And I think as we go through, you'll see that's what really Vandalia is all about, is our patients, our employees, and overall our community. So with that, I'm going to share my screen. Does anybody have any questions before we get started? I know you're muted right now. I don't know if we're going to be on and off mute throughout. But of course, if you have any questions, just raise your hand. Tell me to stop. I want this to be very interactive. Any questions before we get started? All right. I know it's Monday morning, and we're still waking up here, but that's okay.
Can you hear me?
Right.
Can you hear?
Yes, I can hear you.
Okay, we just unmuted. We just got everything set up, so we just want to make sure that you could hear us if they did have any questions.
Perfect. Thank you so much for that. Wayne High School, you all have a wonderful reputation. I love that you are already thinking about where you're going to be, and we're going to talk a little bit about that today. And I thought I'd just give you some overview of different skills that you can use to attain that dream job when you get to that point in your life. So with that, we're going to start out with Vandalia Health's mission, vision, and values. Andrew, if you could go ahead and roll that video for us.
Vandalia Health's mission is enhancing the care of our communities through clinical excellence, one person at a time. We want to be the compassionate, patient-centered provider of choice in all of West Virginia and every community we care for and serve. Being the employer of choice for Vandalia, we're people taking care of people. So we have to have the heart of our employees as well to take care of, if you will, the heart of the community. We have to be an education facility. We have to focus on training people to work in this field.
Excellence is the standard, right? We always strive for excellence.
Excellence is achieved by creating a culture, creating an environment, creating an organization where people feel heard, they feel respected, and that they're able to work to the top of their ability.
Compassion is important in an organization our size because we care for patients. We have to be able to be friendly to one another, forgiving to one another.
Compassion is just the quality of caring about people, trying to take extra time, to stop with them, to stop with a patient, sometimes to cry with them, to just care about people.
Integrity. It means doing the right thing, even when no one's watching.
Integrity means, to me, honesty, being honest with your patient.
Integrity means doing the right thing, and doing the right thing by the people who we are being trusted to care for.
Accountability means to me that your coworkers and the managers can count on you to do your job the proper way.
And I think that it's important for the patient or their loved ones or whoever's there, your coworker even, to make sure that you're accountable for your own actions and what you do.
So respect means that you're taking others into account. So in healthcare, we're all working as a team. We have to have respect for one another, no matter what our role in a patient's care is.
They come in sometimes with heavy hearts, so you have to respect and be compassionate and caring towards each individual.
Respecting people's boundaries is a main component in the care that we provide, not just their cultural beliefs or their religious beliefs, but what they believe that they need medically, and to make sure that we fit those needs for each individual person.
Well, in any industry, I feel like it's important for innovation. If you fall behind, it's hard to give the consumer the best that you can really give them. For this field, in the sciences specifically, that's how you find new cures to diseases, new ways to treat certain things.
We want to try to follow the most evidence-based practice here at our institution to ensure that our patients are getting the best care that we can provide them. And if we're not innovating, then we're not providing the best care.
To me, it means that we're all one organization, that everybody throughout the 13,000 employees work for Vandalia Health and work in Vandalia Health, and that they know Vandalia Health is an organization that cares.
Okay, so the words didn't quite line up with the sound there in the video, but I think you get the gist of it. And really what it comes down to is we're community partners, and we want to make sure we're just providing the very best care that we can to our community. And you can see how passionate our employees and our leaders are about our mission, our vision, and our values. I'm going to go ahead and reshare my screen here. And if you all could just give me a head nod when you can see it. Okay, perfect. Thank you for that. All right, so actually our map is continuing to grow, and this one's already a little bit outdated, but we're now a 17 hospital system with over 190 outpatient clinics throughout the state. As you can see, we're bleeding into the surrounding states now as well. We're building 2 more hospitals, one in the south, and we're building a small format hospital in Harrison County near Bridgeport. We had built another small format Mon Marion Neighborhood Hospital in Marion County. Maybe you've been there before, maybe you've seen the signs. And I think that's going to be the future of healthcare in West Virginia, because what we're doing is we're giving that great patient care, we're providing that care to those local communities without having to ship them up to one of our flagship facilities. And again, that was so successful for that community that we brought that on, and we're going to continue that format as well throughout the state. We did just win Best Place to Work in West Virginia and West Virginia Living Magazine for 2 years in a row. Not to toot our own horn too much, but we are proud of our award-winning culture. And there are so many different opportunities, not only from a learning standpoint, but a career standpoint, exposure, networking. And we're going to talk about all those different channels about how you can become included so you can make the most educated decision on which path you want to take in your career. All right, that's a little picture of the Vandalia Health Mon Medical Center here in Morgantown. There's our award for best place to work. That's 2023. We've already won 2024, and we're working on 2025 right now. So a lot of people in the room are probably asking, where do I start, right? There's so much talk about what's the best avenue for students when they go and try and attain their career. Do they want to go straight to work out of the gate? And sometimes if you're unsure or you do want some additional work experience, that can be the right path for you. Maybe you do want to go straight into additional education and go and get your bachelor's or your master's or some sort of certification. What the important thing to remember about this is that there is no wrong path, and everybody's path looks a little bit different. So just because maybe you're not going to college right out of the gate, maybe you want to go ahead and get some work experience, maybe you want an internship, maybe you're just not sure. And that's what we're going to talk about today, so we can help you make that decision. Just to do a quick poll, if you could just raise your hands, who knows exactly what they want to do for a career? Oh, right. We've got a sure bunch in here. And maybe just nods of heads. Is it all biomedical, or are we going down different paths within the class here? And maybe just to get some interaction here, if those of you, there was a bunch in the room that were sure, if we could just go around and see what you're interested in doing. We could go left to right here.
Medical laboratory science.
Oh, amazing.
Forensic geneticist. OBGYN.
Great.
Radiation tech.
Amazing.
Would be me now. Not biomedical because I switched it, but I'm going it to school to be in music composition.
Oh, amazing. Cool.
But I'm still going to minor in biology.
Backup.
Yeah, that is my backup.
Anybody else want to share?
We've got some more. We had ultrasound.
Ultrasound. So cool. All right, great.
Pharmacy technician.
Pharmacy tech.
Perfect.
Psychiatrist.
Psychiatry. Paramedic. In the back. Do you know? No. Okay. That's it.
Oh, okay, wonderful. Well, I think everybody said something that's in healthcare, so I'm talking to the right people here. And just to go through some of those, ultrasound, I recently just had a child, and I never really saw an ultrasound tech work before. And you almost have to be ambidextrous. You've got to be able to type with one hand while you've got the wand in the other hand. You got to know what to measure and when to measure it. So it is super fascinating just how talented those people are. And I mean, we do a good job of recruiting ultrasound techs, but there is always a need. So that's something that you'll be able to certainly have a successful career in. I've recruited for those in the past. I've also recruited for medical laboratory scientists. How many of you in the room have ever been into a medical lab? Oh, pretty good amount. That's awesome. Well, for those of you that are not, it's a really interesting vibe in there. You're in the hospital, you don't realize there's scientists with lab coats in there. And the way I like to describe it is they have this big conveyor belt that goes all the way around the lab. And it kind of reminds me of a sushi restaurant. If you've ever been to one of those sushi restaurants that has the conveyor belt that goes all the way around, you snag something off of there. That's kind of what it's like. So they have different blood samples, tissue samples that go through all these big different machines so that the scientists can help the clinical providers see what is wrong with the patient, how to best treat it. And then also we have these canisters that are kind of like the bank when you put it in the tube and it shoots up into the ceiling. That's how we get our samples to the lab and back to our clinicians. So there's a lot of things going behind the walls in the hospital that you wouldn't think just by walking down the hallway. Pharmacy techs, always a need for pharmacy techs. And I think you can go be a pharmacy tech in a retail setting, you can go to CVS, you can go to Walgreens. But I think something that we offer that they don't is you can have the retail pharmacy experience, but also the medical pharmacy. So whether you're working straight with the clinicians to give medication to the patients, or you have somebody just walking in the gift shop picking up their Z-Pack or whatever. So we do offer a wide variety of different experiences if you want to go down that route. I know there were some others as well. Just know that, we're going to go through a lot of these different career opportunities. And if you have a question about your specific career path, please don't hesitate to stop me, raise your hand. I'll be happy to go in detail with you. Okay. So why healthcare? And I might open this up here in a moment, but I'll go ahead and start. So for me, job satisfaction is a big thing. Obviously, our CEO and president here at MON, David Goldberg, always says patients are our most important priority. And it doesn't matter whether you're a housekeeper or you're a recruiter or you're a doctor. Everybody should have the patient's best interests first and foremost. And of course, taking care of each other too. And I feel like as a healthcare system, if you can take care of your patients, take care of your community, and take care of your employees, everything else kind of falls right into place because you've got the foundation of an incredible healthcare organization. It's challenging. It's exciting. No 2 days are the same. Even for me, today I'm talking to a high school class. Maybe tomorrow I'm off at a career event. Or I'm running some of our programs as we go through the hospital, helping to acquire talent and to make sure our patients and employees are supported. Job security. As I spoke before, I've had many different roles, but I've never felt the job security that I felt here in healthcare. There's always going to be a community in need of great healthcare. And I think as you get older, you're going to realize that it's like, well, maybe you're making really good money, but then maybe you get laid off or something bad happens in the economy. And then all of a sudden you're not making sales that you need to be making. And, it's just day to day, you've got to wonder, oh, I don't know if I'm going to have a job next week. But in healthcare, there's always going to be a need, and it makes you very flexible and versatile. You can take those skills and go anywhere in the country and beyond. So it really opens up a ton of doors being in healthcare and getting a little bit of experience under your belt. Diversity, flexibility. We're going to go into some of our benefits here in a little bit. But we really try and make sure that our staff is well rested. We got to make sure you bring your very best self to work every day so that you can take care of our patients. And then that includes making sure you have really good work-life balance as well. Education and growth, tuition assistance. That's something that I try and take advantage of every year. We'll talk a little bit more about that in detail, but are things that you want to start thinking about right now, right? Like, okay, we're getting ready to go to college. How are we going to pay for that? Wouldn't it be nice to get tuition assistance from your employer? Typically what I'll say is, even if you're not sure what you want to do, or maybe the first job you get isn't going to be your end goal, you still can get a ton of really great experience. And all of our full-time employees are eligible for up to $3,500 of tuition reimbursement annually. I know I've got mine burning a hole in my pocket right now. I'm just trying to decide which class I want to take this year. Last year, I did a machine learning and no-code AI certification from MIT. And I was very honored and appreciative that my team went ahead and paid for that for me so I could use some of those new skills that the new exciting AI is all about. And it has made my life a lot easier in a lot of ways. But it's just something to think about, whether you want to parlay that tuition reimbursement onto a certain certification, if you want to use it for your college, whatever the case may be. Even if you join us in an entry-level role, whether you want to go and get your pharmacy tech cert, or maybe even start out as a concierge, or you start out as a registration representative or a patient access specialist. Those are all really great entry points into our organization. And then while you're working in those entry-level roles, we encourage you to job shadow, go walk a day in the life in an ultrasound tech or a medical laboratory scientist, and see exactly if that's what you want to do or not. I know a lot of people want to be RNs, but then there's so many possibilities. Do you want to work in the step down unit? Do you want to work in the emergency department? Do you want to work in our birth center? And the only way you'll really know is if you get to experience it for yourself and job shadow some of our veteran nurses and staff that are here. All right, of course, we have internships, externship opportunities. Whether you're in nursing school, whether you want to go into IT, whether you want to be a psychiatrist, or we have the medical lab tech trainees. There's so many different ways that you can go ahead and start getting that real life work experience while you're in school. And I think that's really beneficial for students, because if you're only in school, you're reading the pages, but sometimes what's in the textbook isn't necessarily what's in real life. So it's really nice to be able to gain that knowledge in your education and then being able to see it in action every day. And that just kind of helps put the pieces together and connect the dots. We also have volunteer programs. I'm going to talk about that here in a little bit as well. But that's another great way to be involved with us. And I think as you continue throughout your careers, you're going to notice that networking is incredibly important. So even if you're just volunteering, you get to meet so many different people, and you get to start getting an idea of how a healthcare system works. Any questions on that? All right. So here's an example of some of the jobs that are in healthcare. I'm going to go ahead and let you, I'm not going to read these to you. I know you can read, but just take a look there. Is there anything that maybe isn't represented that you think should be? Again, this is just to give you an idea of some of the positions that are in the healthcare system. But did you know that we need all of these positions as well? And another thing our leadership will say is that anything it takes to run a city, it takes to run a healthcare system. We need an incredible maintenance staff, right? Our plumbers, our HVAC techs, our electricians. Not only do we have to keep the temperature in here, the right temp, obviously, for our patients, for our visitors, for our staff, but there's other things you don't even consider, like the humidity in the room. If the humidity isn't perfect in a surgical setting, we can't perform a surgery, because we have to make sure it's sterile, and there has to be a very specific humidity. So it's critical that our maintenance staff is up to speed on all of that and knows what's going on. Lord forbid our power goes down. We have people on respirators in the ICU upstairs that are keeping them alive. So we have to make sure that those generators kick on at the exact moment those power goes out. That requires a lot of maintenance, a lot of fuel, and for everyone to be in the know on what could happen in an emergency. Billing specialists, another incredibly important one. I recruit a lot of revenue cycle folks right now, like making sure we're charging the right thing to the patient, making sure we're doing everything we can to get it through insurance so it doesn't fall onto our patient to pay. We have a really robust human resources team. I know everybody thinks just general HR, but my specific job is recruitment. So that's what I do every day, is trying to bring bright young minds like yourselves into our organization. But we also have our employee relations team. We have people that are doing conflict resolution, working with the managers with performance improvement plans, those sorts of things. We have a very robust benefits team, so they can not only work on the benefits, but explain them to our employees, as well as just our generalists and our business partners that just help wherever we need them in whatever capacity. Supply chain, right? We have to be able to get our IV bags and our masks, all our personal protective equipment to the departments. So we have what are called supply chain clerks. They work right here in the basement of our materials of the hospital here in our materials distribution center. And what they'll do is they'll sort the different items in the distribution center and then take the orders that the departments are requesting up to the departments and making sure we have the right quantities of everything, so that they're not left without linens or without masks or IV bags or whatever they need. And even the step before that, the procurement analysts, they're the ones that actually go out and purchase all of those items, trying to get the best price, trying to get the highest quality items. So there's a lot of things that go throughout the hospital that you really don't associate with healthcare. We need accountants, environmental services. It does take a village. If our housekeeping team doesn't make it to a room to clean it, we can't put a patient in there. Food, our nutrition team is outstanding. Whether you want to be a patient dining associate, what they'll do is go up to the patient rooms, take the orders of the patients, then go down to the cafeteria and bring the food up to them. But there's a lot that goes into that as well. They have to work with the clinical staff to make sure that there's no dietary restrictions for each patient, to make sure that we're serving them something that's palatable and also healthy for them. And food is medicine. And it takes a village, and no position is too small. And if one department doesn't do what they're supposed to do, it has a ripple effect through the entire system. So these are things you would learn if you come and join us, even as a volunteer, or you want to come job shadow or join us in an entry-level position. You start to get a really good idea of, okay, not only how does your department work, but how does it affect the other departments to make sure that we're providing that great patient care. Do you all have any questions about any of these positions on the screen? There's so many opportunities. If any of you are considering IT, we have so many different IT positions. A lot of what people think is like, oh, service desk. You call them if you have an issue, or a desktop tech. Maybe your iPad or your computer is broken and we need to fix it. But we have applications analysts. We have our robotic programming automators. That's something really exciting that we're working on right now, to build agentic AI to work on our behalf, especially with the insurance companies, to make sure that our claims go through. Go right ahead, Beth.
Yeah, I was just wondering from this list, the other jobs that are non-medical, which is the one that you guys are recruiting the most? Like, where's the one that you're always thinking, oh my gosh, we really need to? Is there one that's needed more than any others?
Well, like I said, every position is important, but some that are frequently open, because we have so many of them, are our registration representatives. So whenever you walk into a clinic, the first person you see that's behind the computer there, that's verifying your insurance, that's taking your ID, that's helping you getting placed into a patient room, those folks are in every clinic. They're in our emergency department, and there's a lot of those positions available. And as people continue to grow in their career, a lot of times they want to move up to registration. Maybe they want to be from registration, maybe they want to go be a manager, or maybe they want to go be a pre-access specialist. So what those folks do is they work in a call center, and they will call the patients and pre-register them. So, when you go into the clinic and you have a clipboard, the first thing they do is hand you that big clipboard, and you got to fill all that information out. Well, the pre-access team will actually call you and pre-register you over the phone. So it's a much more streamlined process once you get in through the door. So you don't have to fill out all that paperwork. We can get you placed right back into a room because we already have all your information. So those are pretty common positions. Of course, food services is important. All of our facilities need a food service team to feed our patients and our staff. Our environmental services, our maintenance, like there's really not one position, but registration is the first that comes to mind, just because it is an amazing entry point in the organization. You start getting some of that clinical terminology, and you can parlay that into so many different directions. I've seen people go on and be leads, be trainers, be managers. So it really is a great entry point. Really good question, Beth. Thank you.
Thank you.
Any other questions, gang? Okay. So this is I know this is text heavy and small, but it just gives you an idea of what some of the salaries are. And these are the median salaries for these positions. And granted, this is 2019 or 2020 data. So these numbers are a little bit elevated even from here, but that just gives you a little bit of an idea of where you may be sitting if you're in one of those positions. And here's another list of that salary data for you, just to give you an idea of what you would be making in these roles.
And you said entry level?
So this is the median. So this is like typically throughout the country, if you've got roughly 5 to 10 years of experience, this is what you would be looking at. And that is interesting how rates are calculated, right? That's a big part of my job, is making sure that we're paying people based off their position and their experience. So the more work experience you have, the higher your rate is going to be. And a common misconception is that, hey, I have the education, that merits me a pay raise. And that's not necessarily true. What your education does is give you a key through the door. That's what opens the door for you. That's how you get the interview, is having that education that the job requires. And then from there, your experience is really what's going to elevate your pay rate. Okay. So why Vandalia, right? I wanted to go over some benefits with you. A lot of our positions are sign-on bonus eligible, so that usually is based off retention. So if we're locking you in for 2 years in a contract, you get a $10,000 retention bonus. We have referral bonuses for some positions. Now that program's changing a little bit right now, but I've seen some of my employees make a career or at least a side hustle on just recruiting their friends, their family, people they know into the organization, and they get compensated for that. So I have a bunch of, I'm not the only recruiter, all of our employees and managers are recruiters. Of course, the tuition reimbursement. As a full-time employee, you're eligible for up to $3,500 of tuition reimbursement annually. And for some select positions, we also have additional scholarships and things that you can utilize once you're part of our team. We have amazing health insurance through Highmark Blue Cross Blue Shield, vision, dental, up to a 4% match on your 401k retirement plan. No matter what employer you go with, if they offer a match, I highly advise you to take advantage of that. It's free money on the table. You may as well have your employer pitch into your 401k. So make sure you're putting in that minimum amount so you get the full company match. We have robust career ladders, right? We don't want you to have to leave our organization to get additional experience and then come back. We want to be able to grow you from within. And that's one of the reasons I'm so proud to work at Vandalia, because a lot of organizations say that, but they don't really back it up in their actions. And actions speak a lot louder than words. So we are continually making our career ladders more robust, more stepping stones, so that we can grow you each step of the way, and you don't have to leave. You can certainly switch around. You can transfer to different facilities, depending on your geographic location, or if you just want to try something new. And you're eligible every 6 months to do that. So I see some people hop all around to different departments until they finally find where they feel like they're the most comfortable and where they can contribute the most. And of course, we're an expanding healthcare system. When I started back in 2020, we were only 3 hospitals. Now we're 17. And we're just continuing to grow throughout the state, along with our partnerships with Charleston Area Medical Center, Minnie Hamilton, Grafton City Hospital, of course, the Mon Health System, and many others. And of course, our award-winning culture that really makes our patients feel comfortable when they walk through the door. A lot of times when someone's coming to the hospital, I'm sure you all have been to the hospital, typically not your best day, right? Whether you're hurt or your family member's sick. So that is why empathy and compassion is so important, and patients and guests are going to remember that. And, we're here to help you through your toughest day. And you have to think about that when you're an employee in a healthcare system, that sometimes you do have to be a little bit more stoic. You definitely need to be empathetic as people come through the door, and just, you don't know what they're going through, but just assume that they're having a tough time. So you just want to make sure to make them as comfortable and as welcomed as possible. And that's a testament to our culture as well. I can walk down the hallway and everybody I talk to is making eye contact with me, asking me how my day was. And that's kind of a rarity. I've worked at a lot of different places, and I've never really felt that cultural magic that we have here at Vandalia. Any questions about benefits?
I have a question. It's not on this, but what do the internships entail?
Oh, great question. So we're not doing our high school internship this year, but in the last few years we have done it. We plan to do it next year. And typically it's a really global view of healthcare. I try and get them into as many different departments as I can so that they can really see from a 30,000-foot scope what is happening and how are we treating our patients. And that's everything from going and seeing a surgery, maybe with one of our fancy Da Vinci robots, to putting a hairnet on and going to the cafeteria, to going back to the generators behind the scenes and pulling it up and starting the generator. We've gone and talked to the pilots of the helicopters to see what life flighting is like. And I try and get them to as many different facilities as well, because every hospital is a little bit different. So the more I can show them, the better. And typically, once we're done with that, we do a capstone project. A lot of times, admittedly, it's a little bit self-serving because I want to see how much they've learned throughout the process. But I try and give the students as much freedom as I can to really be creative with it as well. So they have a capstone project, And it's an amazing networking opportunity. And they also get to see, okay, which position would I be interested in taking? We also have higher level internships. So I have a master's intern right now that helps me out a lot. I think every master's intern I've ever had has gotten a fairly high up position right after their internship. We have administrative fellowships that they fall into if they interview well. And boy, is that a competition, because we have so many amazing students in our area, you all included, that are interested in these positions. So we're going to get into that here in a moment, but interview skills are incredibly important. You're winning that person over and selling yourself. And sometimes that does feel a little bit icky because, maybe you're probably very humble. You don't want to have to sell yourself, but that's the time. That's the time to do it, is to prove to them why you're the best person for this position. But just to bring it back full circle, there's a lot of different internship opportunities. I've got a couple of IT interns in the South right now. We're getting ready to make offers too. I'm going to do that later today, so I'm excited about that. Any other questions? Go ahead.
So obviously you all have a lot of benefits. You match tuition, you have competitive pay, really good benefits, but also aren't you all a nonprofit?
That's correct. That's correct.
So how do you continue to expand at such a high rate while also taking care of your patients and focusing on the price that they pay for medical care?
That's a great question. Well, and there's a little bit of a misnomer there, because just because we're nonprofit doesn't mean we don't make money, right? I think the last figure was, just to keep all our facilities open in the state and keep the lights on, that's $7 million a day. And that doesn't even include our payroll. So there's a lot of money that we have just to be able to keep our organization going. But we utilize many different things to get money, whether that be philanthropy, right? We have all sorts of different events we use through our auxiliary. We had a really fun dragon boat race at Stonewall Resort last year that was cool. It was like a team building thing. But we have tons of sponsors that come and give money to that. You may have heard of our Bob Huggins Fish Fry, where we gather money through those events as well. We have the amazing Ball of the Year we always do, and that gathers money. We work with the ARC grant. We work with many different federal institutions to get money from there as well. And then, of course, we're not doing it to make a huge profit. We're doing it to continue to grow, right? And the mission behind that is we want to be able to have accessible patient care for the entire state. So that's going to obviously require more money to be able to build these new facilities and give those offerings. But we use different grants. We use a lot of different fundraisers. Of course, the patients are still paying, whether they're using insurance or Medicare or whatever the case is. So while we're not going to pinch every penny here to make a profit for any sort of investors or anything like that, we still have a robust, searching for words here, but ways for us to bring money into the organization, more or less. But that's a great question. And it's something that, it is interesting. How do the hospitals make money and continue to grow even when they have that nonprofit designation? Any other questions? Go ahead.
Since you all operate on such a large scale, how do you guys problem solve and troubleshoot?
Great question. So we have a whole quality department, right? And what they do, they crunch the numbers. They see how long is it taking for our patients to recover and move on with their lives, right? And if, Lord forbid, something bad happened to a patient, we have to do a deep investigation and see exactly what happened. Even on the HR side, we get third-party surveyors come in and they'll check our files to make sure, did we run a background check? Did we make sure everybody had a pre-employment physical? That's why it's really healthy to audit your files beforehand. And no matter what oversight committee you end up answering to in your careers, you want to make sure that your files are ready to go before that surveyor gets there. But if you do things right and you're following the process every time, you don't have to run around like a chicken with its head cut off when it comes time to show your work. So it's something that we have to constantly audit ourselves. The quality team is auditing the whole hospital here. And we're seeing, okay, how can we have process improvement? What can we do to not only save us money, but make sure that we're getting even better patient care? I hope that answers your question. All right. I've got how much time do I have here, Beth?
It's just like maybe 3 minutes.
Oh, I'm talking too much. I had so much to get into. Okay. So I wanted to mention my Explorers program. It's for those aged 14 to 21. We meet every month. Usually it's the last Wednesday of the month. We have a different department come down. They do a really great presentation. We do a fun hands-on activity, and then we tour the department that's presenting. We've had a lot of really cool ones. We had our radiology and ultrasound, our imaging department come down. We got to see all of the different equipment that they use. We had the lab come down. They're about to do another one. So if you all are interested in making the trip to Morgantown, I know it's a little bit of a journey for you guys, but I can send the QR code over because it's typically $100 fee, but I will waive that for you all if you decide to come. It's actually going to be this Wednesday at 4:30 will be our next one. That's going to be our clinical educators. So they're going to go through everything they do to get our nurses, all our clinical staff up to speed, and that continuing education as well that you need annually. So if you're interested, I will send the QR code. We'd love to have you come to the Explorers program. I was going to go into resume tips and interview skills. Obviously, we don't have time for that. I'm sorry, but thank you so much for having me. Thank you for being so interactive. It was great to hear about all the things you already know what you want to do, which I think is amazing. You are so far ahead of the game. And of course, I will share all my contact information with you all. So if you'd like to have a one-on-one with me to discuss your specific career goals, I would be happy to do that. Please know my door's always open, my phone's always close to me, and I would be happy to connect with each and every one of you. Okay, any other questions for me? Sorry, I'm long-winded.
Any other questions? I think this was a great session, though. I know we didn't get completely through everything, but I just think that interacting and asking questions is always very important. So I'm so glad that we could interact today and be together this morning. Such valuable information about Mon Health and Vandalia Health. We appreciate you so much. I will follow up with the teacher and send your contact information so they can have that.
Okay,
and
great.
just want to thank everyone for a great session today. All of our work-based learning sessions live on our website, educationalliance.org.
Please, Lainey, call please to the office to sign out.
educationalliance.org/work-based learning. So if you want to watch any of those or look at any of the past presentation, they're all going to be there. So have a great week, everyone. Thank you so much.
Thank you. Have a great day.
Thanks,
Guy. Good job. Thank you.